Hello, my name is Dr. Rita Romero. I am a psychologist in California, and I also am CEO of San Diego Psychotherapy Associates. We have a very passionate group of psychologists. And I want to talk with you today a little bit about one of the treatment approaches we use for depression and also for anxiety, and that is cognitive behavioral therapy, or also known as CBT. You may have heard of it. And CBT is what we call evidence-based treatment. Primarily what that means, it's been studied again and again in many repeated studies over the years to look at its efficacy, to see how effective is it really to reduce or even eliminate anxiety in certain areas and any kind of depressive mood. So CBT, the premise of it is that we have developed some ways of thinking, usually early in life, or some behavioral patterns, what we do in our years of growing up. And once we humans learn something, develop a habit, it is very challenging to change that pattern. We keep reverting back. So what we do in therapy is to be able to, number one, identify what are particular patterns of thinking. What are those muscle memories that we've developed that may have utilized and we've utilized and been healthy and helpful when we were young, but no longer serve us? And then how do we change our ways of thinking that affects how we feel and how we behave? An example of an unhealthy thinking pattern may be dichotomous thinking, or easily known as all or nothing thinking. It's either this way or that way. I've either done an amazing job or I am a failure. Or it may be a way of thinking that will be predicting the future. Before I walk into that business meeting, maybe things aren't going to go well. Maybe they aren't going to like me. So we haven't even walked into the meeting yet, but we're predicting is what's going to be happening. The other one may have been that we will emphasize the negative, blow that up. So for example, maybe I did a public speaking, 25 people love me, one person didn't. I keep focusing on the one that didn't approve. So we will identify those thinking patterns and then learn, more importantly, is how to change them. And that's repeatedly either through role playing, in life exposure to doing things differently and reporting back to our therapist. We may be to learn some ways to calm down our body. So we're operating much more with our good, we call frontal lobe, our smarts, rather into that kind of reptilian brain of fight or flight. So these are the things we'll do with CBT. There's many aspects of it. More importantly, learning what we've learned, our core beliefs that I have worth, I have value, how we want to change those core beliefs. That takes a while. And then when it takes off, we are unstoppable. So feel free to give us a call at San Diego Psychotherapy Associates. We work with people all over California, and we'll be happy to answer some of your questions and see if we could be help to you. Good mental health